Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're exploring how the health of your mouth can influence migraines, gut discomfort, and widespread body pain in women.
Thanks, Ethan. I'm Alara Skye, here to unpack the latest findings showing that poor oral hygiene isn't just about cavities. It may set off systemic inflammation that sensitizes the nervous system and amplifies pain signals.
The catalyst for today's discussion is a recent study of 158 non-smoking New Zealand women. Researchers linked lower self-reported oral health scores with markedly higher rates of chronic migraine and overall body pain intensity.
More than half of the participants who suffered frequent migraines fell into the two poorest oral health categories. They were 60% likelier to report moderate to severe body-wide pain and 49% likelier to experience migraines regularly.
Let's clarify why the mouth matters. Once gum tissue becomes inflamed, pathogenic microbes and their toxins can cross into the bloodstream, travel to distant tissues, and disrupt immune balance, fueling inflammatory chemicals that heighten pain perception.
The study pinpointed several bacterial culprits. Mycoplasma salivarium and Gardnerella vaginalis were significantly overrepresented in women with chronic migraines. Other offenders, Parvomonas micra, Solobacterium murrae, Dialister pneumosintes, and Prevotella denticola, correlated with widespread musculoskeletal tenderness.
Many of those organisms generate lipopolysaccharides that stimulate release of calcitonin gene-related peptide, or CGRP, a molecule increasingly targeted by new migraine medications because it directly exaggerates nerve sensitivity and vascular inflammation.
Another mediator is vascular endothelial growth factor, or VEGF. Elevated VEGF has been documented in migraine, fibromyalgia, and periodontal disease. Overgrowth of oral pathogens elevates VEGF, promoting both new blood vessel formation and painful neural inflammation.
Equally telling was microbial diversity. Women plagued by migraine and abdominal pain showed lower Shannon diversity indices in their saliva. Fewer bacterial species mean harmful strains can dominate unchecked, perpetuating inflammatory signaling loops.
Diversity acts like ecological resilience. When benign species are plentiful, they crowd out aggressors. Strip that variety with sugary diets or antiseptic mouthwash, and opportunists gain ground, producing endotoxins that keep pain pathways switched on.
Hormones add another layer. During menopause, fluctuating estrogen reduces salivary flow, impairs gum defense, and accelerates bone loss around teeth. A recent survey found a third of women over 40 noticed declining oral health, yet rarely linked it to hormonal change.
Reduced saliva thickens the perfect storm: less mechanical cleansing, more acidity, and deeper periodontal pockets. Anxiety from oral discomfort further suppresses saliva, creating a feedback loop that compounds microbial dysbiosis and, by extension, systemic pain.
How should listeners respond? First, rethink daily hygiene. Brushing with a gentle fluoride-free paste, flossing and scraping the tongue remove biofilm without nuking beneficial microbes. Skip alcohol-based rinses that indiscriminately decimate the microbiome.
Oil pulling with coconut oil is a practical add-on. Trials show it lowers plaque indices and bacterial colony counts, notably gingivitis-linked strains, without altering oral pH or harming commensal flora.
Diet matters equally. Refined sugars and sticky processed snacks feed pain-promoting bacteria. Space meals emphasize whole foods, and choose saturated fats like tallow or grass-fed butter that resist oxidation and do not nourish pathogenic oral biofilms.
For listeners transitioning from very low-carb diets, reintroduce carbohydrates slowly. Start with pulp-rich fruits or properly prepared rice to feed beneficial microbes, while avoiding abrupt blood sugar spikes that could exacerbate endotoxin release.
Gut health mirrors oral health. Constipation, bloating, or loose stools hint at dysbiosis that can reseed the mouth via the esophagus. Improving digestion with fiber, adequate hydration, and targeted probiotics indirectly stabilizes the oral ecosystem.
Professional oversight remains essential. Schedule biannual visits with a biologically minded dentist who evaluates gum pockets, performs thorough cleanings, and flags early infections before they ignite systemic inflammatory cascades.
Let's revisit the study's numbers. Among women with the poorest oral scores, nearly 60% reported moderate to severe body pain. The statistical link remained significant even after researchers adjusted for sugar intake, body mass index, and medication use.
That robustness suggests causality rather than coincidence. When Mycoplasma salivarium dominated, odds of chronic migraine jumped sharply. Lansfieldella parvula abundance also tracked with migraine frequency, independent of dietary variables.
Fascinatingly, Gardnerella vaginalis, better known for disrupting vaginal flora, showed up in oral samples associated with both low oral health scores and higher systemic pain, underscoring how microbial misplacement triggers immune alarm bells.
Pathogens exploit inflamed gum tissue as a gateway. Once inside circulation, they can lodge in joints, the gut lining, or neural tissues, secreting metabolites that sensitize pain receptors and perpetuate central sensitization disorders.
Central sensitization describes a nervous system stuck in high alert, amplifying normal sensory input into pain. The mouth-body axis now appears to be an overlooked ignition switch for that maladaptive rewiring.
Importantly, microbial shifts are reversible within weeks. Studies demonstrate measurable improvements in plaque composition and systemic inflammatory markers after consistent tongue scraping, dietary cleanup, and cessation of harsh antiseptic rinses.
Let's summarize actionable steps. 1. Prioritize mechanical cleaning, brush, floss, scrape. 2. Eliminate daily alcohol-based mouthwash. 3. Integrate coconut oil pulling for 15 minutes every morning.
4. Limit refined carbohydrates and sweets that linger orally. 5. Choose stable saturated fats over seed oils. 6. Incorporate whole fruits and resistant starches gradually to foster microbial diversity.
7. Hydrate after meals with plain water to wash away residual sugars. 8. Address gut dysbiosis concurrently through balanced fiber intake and, when appropriate, professional guidance on probiotics.
9. Obtain regular dental assessments, especially during menopause, to preempt dry mouth complications. 10. Monitor oral signs, bleeding gums, persistent coating, or halitosis, as early warnings of systemic inflammatory load.
Some listeners might wonder about mouthwash substitutes. Mild saline rinses or herbal infusions like chamomile can freshen breath without destroying microbial balance, serving as gentler options.
Remember, the mouth is the initial segment of the gastrointestinal tract. Treating it singularly ignores its continuous interaction with gut, brain, and immune circuitry.
The New Zealand study bolsters earlier findings that periodontal therapy can lower systemic inflammatory mediators and even improve migraine frequency, reinforcing the bidirectional nature of oral and neurologic health.
Emerging research also links oral dysbiosis with endocrine function, suggesting that restoring microbial balance may ease hormone-related symptoms, including certain menopausal discomforts compounded by dry mouth.
For women navigating menopause, saliva testing for hormonal metabolites alongside microbial profiling offers a personalized snapshot, guiding both dental and integrative strategies to mitigate pain and oral deterioration.
While the current data focus on women, men are not exempt. Studies in mixed cohorts reveal parallel associations between periodontal disease severity and musculoskeletal pain intensity, though hormonal variables shift the risk landscape.
Let's address a common misconception. Bleeding gums are never normal. Even slight bleeding reflects capillary fragility and bacterial invasion, marking an early stage of periodontal disease with potential systemic ramifications.
Similarly, chronic bad breath often signals protein-digesting anaerobes, such as Solobacterium morae. Their volatile sulfur compounds cross oral tissues, provoking low-grade inflammation that can escalate migraine triggers.
Small daily habits compound. A 5-minute routine, 2 minutes brushing, 1 minute flossing, 30 seconds scraping, and 90 seconds oil pulling may save hours of headache and widespread discomfort down the line.
Keep toothbrushes aired and replaced every 3 months. Damp bristles harbor pathogens, potentially reseeding gums after cleaning. Use soft bristles to avoid microabrasions that permit bacterial ingress.
Listeners frequently ask about probiotics designed for the mouth. Lozenges containing Streptococcus salivarius, K12, have shown promise in reducing halitosis and restoring balance, though they complement rather than replace mechanical hygiene.
Fermented foods like kefir and sauerkraut also contribute diverse organisms that transit the oral cavity, offering transient colonization and competitive inhibition against opportunists implicated in migraine pathways.
Drawing our discussion together, evidence positions the mouth as both sentinel and instigator. Addressing oral dysbiosis may downshift central sensitization, offering a low-cost, accessible avenue to relieve chronic pain.
If you're battling migraines, fibromyalgia, or unexplained gut pain, start by inspecting your gums and tongue. Intervening there aligns with the research and could be the linchpin to broader relief.
That wraps today's exploration of poor oral health and systemic pain. I'm Ethan Foster, thanking you for joining us on Dr. Mercola's Cellular Wisdom.
And I'm Alara Sky. Stay informed, care for your mouth, and we'll meet you next time with more evidence-based insights into whole body health. Goodbye for now.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.